The news day continues here on One News Now. I'm Charles Lejano. MMDA Chairman Benhur Abalos shares that the government has come up with a new quarantine classification for Metro Manila. In an interview with Radyo 5, Abalos said that apart from MECQ and GCQ, another possible quarantine classification for Metro Manila would be a so-called hybrid MECQ. Abalos explains that the DTI, NEDA, and DOH presented the idea to Metro Manila mayors to make sure that border controls remain intact while more businesses get to reopen.
You get the best of both worlds, no? So, ang ECQ po na may mga kasamang bagong mga activity. For example, yung mga construction, papayagan na po. At saka po itong mga ibang mga activities na ililista ng DTI po. Maganda kasi rito, yung border controls mo, mahigpit pa rin. Kasi kung GCQ tayo, labas-pasok na tao sa atin. Yun ang nakakatakot. No? So, I mean, you take control of the border control, mahigpit pa rin mobility, pero maganda na po ang ating mga activities.
Apart from this, Abalos also announced that Metro Manila mayors will once again readjust curfew hours in the region. Starting next month, curfew hours in NCR will run from 10 p.m. to 4 a.m. the following day. Targeted reopenings, zero curfews. This is what an economist is proposing for the next community quarantine status in the NCR Plus come May. On One News' The Chiefs, economics professor Emmanuel Leco warns that another lockdown extension would force more businesses to shut down and more workers to lose income. Leco notes that the emergence of community pantries is indicative of the widespread hunger among Filipinos. And the Economist proposes a targeted reopening of the country's COVID-hit economy, coupled with measures like mass testing and more government aid. Leco also believes that curfews should be lifted to allow 24/7 work operations. And the Octa Research Group had earlier warned that relaxing the quarantine status could bring back a higher rate of transmissions.
Personally, I think we cannot just reopen now because all of a sudden the numbers will go up again. So what do we do? I think we can start reopening, but selectively. We know where the hotspot areas are. Do we lock down the whole city, the whole region, or do we now already select which areas are considered hotspot? I believe that there shouldn't be any curfew. In fact, they can use that to rotate the staff deployment. Some people can work at night, some people can work during the day. Let's make it a 24-hour cycle, making sure that the social distancing is maintained.
The health department says that nobody is allowed to distribute Ivermectin for COVID-19 treatment, except for the 5 hospitals that were granted compassionate use by the FDA. The DOH made the statement after one lawmaker is once again set to provide free Ivermectin to the poor this week. To give us details on this and among other topics mentioned during today's health briefing, we have Greg Gregorio again joining us live from Mandaluyong. Greg, how will the Department of Health deal with this new initiative?
Charles, the Department of Health has highlighted that aside from the 5 hospitals given the compassionate special permit for the use of Ivermectin on selected patients, on their COVID-19 patients, no one is allowed to distribute Ivermectin so far. Health Undersecretary Vergere also mentioned that as of now, there's only one pending application for a certificate of product registration for Ivermectin with the Food and Drug Administration. But to highlight, this CPR or Certificate of Product Registration application is for the anti-parasitic use of Ivermectin as it is known for. Vergere then added that as to the latest advisory of medical societies in the Philippines, including the DOH and the Food and Drug Administration, there's still no strong evidence saying that the use of Ivermectin is good for COVID-19 patients having mild to moderate symptoms, moderate case. The DOH also said that they are suggesting against the use of ivermectin also for severe COVID-19 cases. Charles?
All right, Greg, thanks for that. So much for ivermectin, at least for now. But then let's talk about the coronavirus status in India. Big news today. There's a record high number of cases there. Do we have any news on the spread of this new variant from India?
Yes, Charles, the Department of Health has described the COVID-19 situation in India as having a high transmission. According to Health Undersecretary Maria Rosario Vergere, even though the detected new variant in India is still considered as variant under investigation and not as a variant of concern, the Philippine government has already decided to issue a travel ban starting April 29 to May 14 for travelers coming from India, including those Filipinos who would like to return to the Philippines. Charles?
All right, Greg, what did the health department have to say about Filipinos who are currently based in India, and how will this affect our vaccine supply due to this ongoing surge?
Charles, for the Filipinos residing in India, so currently, Vergere said, all they have to do is that regardless of what variant or what type of SARS-CoV-2 variants there is or there are in a country, all they have to do is follow minimum health protocols. That goes the same to our countrymen here in the Philippines, that since we are also experiencing or we are also seeing variants here. Vergere said, even regardless of variants, minimum public health standards would still be of use in preventing transmission. And for the arrival of vaccines, Vergere admitted that the supply of vaccines coming from India will be affected, but the National Task Force or the vaccine cluster of the government has a flexible plan for our vaccination program. They are able to reallocate or redistribute the expected doses of vaccines which are expected to arrive in May, June, and July. Charles?
All right, Greg, thanks for that. Anything else worth mentioning from today's briefing?
Yes, Charles, the Department of Health has also made a reaction regarding the viral tweet of a staff nurse in Lucena showing a photo of his special risk allowance, which he received for his work from September 15 to December 19, and it only amounts to a little over 681 pesos. There are calls or there are comments that this is quite low for a 4-month exposure or work in the hospital, but Health Undersecretary Maria Rosario Vergere said they would still need further details about this, especially on how the facility computed the SRA, but Vergere highlighted that SRAs and other hazard pays due to the healthcare workers must be given by every health facilities in the country. Charles?
Thanks for that, Greg. That was Greg Gregorio reporting live from Mandaluyong. India's record-breaking surge in cases continues to overwhelm its hospitals as the explosive outbreak also raises the risk of the new virus mutations that could threaten other countries. Let's hear the latest on the situation from Bloomberg's Ruth Pollard as she visited a 1,000-bed private hospital in New Delhi to talk with the doctors fighting on the front lines.
We are short of bed, we are short of oxygen right now, and we are short of other things. It is very difficult right now to see the patients.
We're here in the emergency department of Mulchand Hospital in the capital, New Delhi. This wasn't part of the hospital's emergency services until the second wave of COVID hit India. Now they've had to use every available space to cram in patients who are incredibly ill. They're in need of oxygen, ventilation, and critical care. The oxygen supplies here have been running critically low for days and days. Doctors tell us they don't know how long their oxygen supplies will last, when they'll get another delivery, or how much they'll get delivered. It makes it incredibly difficult to run this emergency department and get through this crisis.
People are not realizing the fact that it's a second wave is always deadly. We always anticipated second wave somewhere in April and May, but we never knew it will hit us so hard and so fast, because last time when Corona was here, we got some time for preparation because the cases were not coming. But this time after Holi, within 1 day, we had around more than 2 lakh cases. And the problem is everybody requires some oxygenation and they need some kind of treatment, and hospitals are our burden.
Add to that, many of their colleagues, many of the doctors and nurses here are COVID positive themselves and have had to go home and isolate, leaving this hospital incredibly short-staffed and running on empty.
We are really hard. We are managing the patients to save their life, and what to do? We have to work on this. We have to, with this our situation, we have to fight for this. It's like a war situation.
The Olympic torch relay has made its way through the picturesque Kagoshima Prefecture on Tuesday as it continues its march on the way to Tokyo. This as the Tokyo Olympic Games are slated to open on July 23. Onlookers were safely distanced from the routes as torchbearers made their way through Japan's Kyushu and Ryukyu Islands. However, for next week's route, the relay in Okinawa will take place without spectators, while another section has been cancelled due to the risk of COVID-19. Recall that the Japanese government has declared short and powerful states of emergency in several prefectures 3 months before the Olympics, as the country continues to struggle to contain the coronavirus. And those are the top stories of the hour. Join us again later at 1 p.m. as we continue to monitor the day's biggest stories. You can also catch One News on Signal Play. Register for a free account at www.signalplay.com so you can stream One News live anytime, anywhere. I'm Charles Lejano. Mask on, wash hands, and stay safe, Philippines. We are One News.